Hello everyone, welcome back to Doctor's Quiz. Get ready to learn some MCQs on pathology from today's video. And if you are new to my channel, please subscribe to Doctor's Quiz to learn medical subjects through quizzes. Are you ready? Let's get started. What is meant by phagocytosis? The options are cell dividing, cell eating, cell drinking and cell repairing. And the right answer is cell eating. Which is a common site for the accumulation of fat in our body? The options are liver, heart, kidney and pancreas. The right answer is liver. Intracellular accumulation of neutral fat within the parenchymal cells is known as. The options are nephrosis, lipidosis, steatosis and lipolysis. And the correct answer is steatosis. Which syndrome is characterized by poor phagocytic activity of neutrophils resulting in recurrent bacterial respiratory and other infections and oculocutaneous albinism? The options are Leopard syndrome, Hermansky-Pudlak syndrome, Cartagena syndrome and Chediak-Higashi syndrome. The right answer is Chediak-Higashi syndrome. What is meant by pinocytosis? The options are cell eating, cell drinking, cell dividing and cell repairing. The right answer is cell drinking. The eosinophilic spherical cytoplasmic inclusions found within plasma cells, especially in conditions of excessive immunoglobulin synthesis, is known as. The options are Mallory's bodies, Russell's bodies, melanin and hemosiderin. The right answer is Russell's bodies. Which enzyme is necessary for synthesis of melanin from tyrosine? The options are lipase, tyrokinase, tyrosinase, hyaluronidase. The right answer is tyrosinase. Which among this is known as wear and tear pigment? The options are hemosiderin, melanin, bilirubin and lipofuscin. The right answer is lipofuscin. The hyperpigmentation on the skin of face, nipples and genitalia and occurs under the influence of estrogen during pregnancy is known as. The options are lentigo, cafe-late spots, melanosis and chloasma. The correct answer is chloasma. Raindrop pigmentation of the skin is a characteristic of which condition? The options are Addison's disease, arsenic poisoning, leukoderma and melanoma. And the right answer is arsenic poisoning. Which syndrome is characterized by perioral pigmentation? The options are Albright syndrome, immotile cilia syndrome, Peutz-Jeghers syndrome and Dubin-Johnson syndrome. The right answer is Peutz-Jeghers syndrome. Name of the pigmented spots seen in neurofibromatosis. The options are slate grey navy, Mongolian spots, liver spots and cafe-late spots. The right answer is cafe-late spots. The pigmentation of the mucosa of the colon is known as. The options are melanosis coli, lentigo, hemozoin, melanosis pylori. And the correct answer is melanosis coli. a pre-malignant condition in which there is focal hyperpigmentation on the skin of hands, face and neck, known as. The options are Lendigo, melanotic tumors, albinism and Addison's disease. And the right answer is Lendigo, which condition is an extreme degree of generalized hypopigmentation in which tyrosinase activity of the melanocytes is genetically defective and no melanin is formed. The options are Dubin-Johnson syndrome, albinism, Addison's disease and Lendigo. The right answer is albinism, in which condition when the urine of the patient is allowed to stand for several hours in air, it will turn into black. The options are diabetes mellitus, diabetes insipidus, alkaptonuria and interstitial cystitis. And the right answer is alkaptonuria. In alkaptonuria, the black color urine is due to the oxidation of. The options are hemosiderin, melanin, bilirubin, homogenesic acid. And the right answer is homogenesic acid. Iron is stored in the tissues in how many forms? 2, 3, 4, 5. And the right answer is 2. Hemosiderin is formed by aggregates of. The options are apoferritin, ferritin, hemoproteins and hemozoin. The right answer is ferritin. Excessive storage of hemosiderin occurs in situation when there is increased breakdown of. The options are red cells, white cells, platelets and all the above. And the correct answer is red cells. The triad of pigmentary liver cirrhosis, pancreatic damage resulting in diabetes mellitus and skin pigmentation is seen in. The options are liver failure, Bantu's disease, hereditary hemochromatosis and Addison's disease. The right answer is hereditary hemochromatosis. A hemoprotein brown-black pigment containing heme iron in ferric form is. The options are melanin, lipofuscin, hemozoin and hemosiderin. The right answer is hemozoin. Hematine pigment is seen most commonly in which condition? The options are acute malaria, chronic malaria, Kala Azar and enteric fever. The right answer is chronic malaria. In infants, rise in unconjugated bilirubin may produce toxic brain injury called. The options are hydrocephalus, shaken baby syndrome, meningitis and kernicterus. And the right answer is kernicterus. Which disease is also known as bronze diabetes? The options are hereditary hemochromatosis, acquired hemosiderosis, alkaptonuria and Addison's disease. And the right answer is hereditary hemochromatosis. Yeah, that's all for today's video. And I'm leaving hopefully that you have learned something on pathology from this video, and I will be back in another episode of Doctor's Quiz on coming Friday. Until then, bye bye, take care.